Thank you all. As you all know, the International Forum for Promoting Homeopathy is conducting regular webinars since last 1,246 days. And today, our guest is none other than Professor Dr. Kulwant Singh. As you know, sir is a regular presenter in this forum, and almost all the presentations were excellent, and there were a lot of great slides from sir. All the history and everything were shown from the very beginning itself. Last week, sir has presented one session beautifully. And as you know, the subject was benign prostatic hyperplasia and homeopathy. And today, sir will be talking about the second part of the same. As you know, sir was a retired professor as well as the principal from a homeopathic medical college. And sir has completed his MD from GD Homeopathic Medical College, Patna, ex-dean and faculty of homeopathy, as well as the principal of Sindhubhum Homeopathic Medical College and Hospital, Jamshedpur since 2000, and is a teacher of 43 years of experience. That's a great thing. And not only that, sir is a great homeopathic doctor also. He has having a lot of cases, not only simply teaching the people, but also treating patients with the classical homeopathic method. And that is the beauty of sir. Sir's knowledge in homeopathic materia medica as well as in organon are exemplary. And sir was the former member of CCH, and sir was there as a ex-inspector of the Central Council of Homeopathy, New Delhi, and sir was a guide, and so many things are there with sir. And there is, since sir is waiting there, and we everybody knows sir nowadays, and not go briefing all about. So let us welcome our Kulwant Singh sir to this session. Welcome, sir.
Thank you, Dr. Dhanesh. Can I share?
Yes, sir. And wait, 1 minute, sir. Your co-host now, sir. Yes. Now you can share, sir. Yes. Visible, sir.
Thank you, sir. Thank you so much. In the last lecture, we had discussed the benign prostatic hyperplasia, the history, the structural changes, the pathological changes, and today we will try to finish these things with homeopathic therapeutics, homeopathic medicines for benign hyperplasia. So let us start with some summary of the last lecture. We had discussed the enlargement of the prostate. This is in black, and the side effects of this enlargement of the prostate can cause so many symptoms or so many complications, like if there is a back pressure of the urine to the kidney, it will create hydronephrosis. If there is a back pressure of urine in ureter, it will create hydroureter. In the bladder, if there is accumulation of urine due to blockage or due to pressure, due to obstruction of this part of urethra, which is known as prostatic part of urethra. So that causes frequent involuntary urination due to the regular pressure of the urine on this part. And as the urine will not pass completely, it will cause residual urine will be more than normal. When if there is obstruction here, there will be dysuria and painful urination. There will be retention of urine. Urine will be here in the bladder more than normal and more than normal time also, and which may cause the growth of bacteria and which will be causing cystitis. As this is not completely evacuated, there will be incomplete evacuation of bladder. And as this is blocked, there will be constant straining for urination. And you see, all these symptoms are present in case of prostatic enlargement. We have all discussed these things in the last lecture. Now we will be starting some discussion on the homeopathic management of this case. So as you see, that mainly the miasmatic part is SORA is the foundational miasm in this case in relation to BPH. SORA might manifest as a predisposition towards urinary issues such as difficulty initiating urination, weak urinary system, and frequent urination. This is the beginning of these things, and gradually when there is severe prostatic enlargement, most of the symptoms become psychotic. So in the context of BPH, psychosis could relate to an overgrowth of hypertrophy of the prostate, leading to urinary symptoms, leading to all complications. One reason is enlargement of the prostate gland, that is growth of the prostate gland, and any abnormal growth obviously comes to psychotic miasm. And the last is in BPH, the syphilitic miasm might contribute to the development of indurations or nodules in the prostate gland, indicating deeper-seated pathological changes and complications related to chronic inflammatory process. Syphilitic symptoms are few in case of prostatic enlargement because these syphilitic symptoms are present more when there is carcinoma of the prostate gland. So when there is carcinoma of the prostate gland, we can see this more. Otherwise, more and more symptoms belong to psychosis, psychotic in nature. And that is why Thuja is one of the best medicines for prostatic enlargement because it is the greatest antipsychotic medicine. Naming the medicines, if soric miasm is there, the best medicines are Sabal Conium, Thuja. These are addressing the urinary difficulties. Irritation. SORA is irritation. So irritation symptoms, irritative symptoms like urinary difficulties, weak stream, frequent urination, involuntary urination, all these things come into soric miasm, and the medicines, some of medicines are Sabal Conium, and Thuja. When it comes to psychotic, Sabal is there, Thuja is there, and Staphysagria for the growth, together targeting the glandular hypertrophy, incomplete voiding, and urinary retention. If the retention of urine, not irritation. Irritation part is frequent urination, no control, involuntary, and this is incomplete voiding. And when it comes to syphilitic, which is rare, BPH is not having syphilitic symptoms more, and the medicines are Orometallicum and Conium Max. They are addressing complications from degenerative changes in the prostate. Mind it that degenerative changes in the prostate are not very common in prostatic hyperplasia, benign prostatic hyperplasia. Now the medicines, one of the best medicines, universally acclaimed medicine, that is Sabal, or it is commonly known as saw palmetto. You can see this is a palm-like tree, one of the best medicines for hypertrophy of prostate gland. And how does it help? Okay, this is the most important part of this, that it helps to reduce DHT levels in the blood. I have been repeating in my lectures that the reason behind enlargement of the prostate gland is DHT level, increase in the DHT level, dihydrotestosterone. And if there is increase in this level, ultimately it causes the enlargement of the prostatic cells and tissues and glands, which we have already discussed. So this medicine is having a property that it can reduce DHT level, and this has been recognized. This property is recognized by the Boston University, USA. So this is an universal medicine. Allopathics are using it. Ayurveda is using it. All other medicine, medical science is using it. Even Chinese medicines are using it. And in homeopathy, this is also one of the best medicines. And the symptoms are constant desire to urinate, paresis of sphincter basically. This is very important. This is not present in all medicines. This is almost paralysis of the sphincter of the urinary bladder. And if there is a paretic condition, two conditions will happen. One, sometimes the urine will be involuntary because of the paralysis, and sometimes there will be retention of the urine because the urine vesicle sphincter is paralyzed, so it will not open properly for evacuation of the urine. So both conditions can be present simultaneously in case of a subulcerulata patient. There is difficult urination. If there is congestion, accumulation of water, urine for more than proper timing, there may be cystitis. And sexual neurotics with weakness. The sexual desire is increased, but the efficiency is reduced. Sexual desire is increased because there is a constant pressure on the urethra. By the accumulated urine in the bladder, there is constant tickling, and that increases the sexual desire. Next medicine is conium mac. Very, very important medicine, especially when the patients are old, very old. It is, we have read in the Mathematica that this is a medicine for old sinners, old bachelors. So old people who are having a tremendous sexual desire but unable to function properly, and conium means conios, which means spin or will. That is the vertigo. So this vertigo, we know that is one of the important medicine symptom of conium maculatum. And macula means spots. This plant of conium is having some spots. For older individuals, old bachelors experiencing urinary difficulties due to enlarged prostate. And you see, there is history. You know that the common name of conium is poison hemlock. So this poison hemlock was given to great Hippocrates, and he died after drinking this poison. This was a penalty to great. So there is weak urine. He is being given the poison hemlock. This was given in the prison, and he died after taking this. There is dribbling of urine after urination. There might be pain or burning, but please remember, all these disease symptoms may be present in several symptoms. Several patients will be having the similar symptoms. This is disease symptom of prostatic gland due to the enlargement of the prostate. But conium is well suited when there is patient is very old. The old sinners, old bachelor who are not, old bachelor means who are not enjoying their normal sexual life. So in this cases, conium has worked miraculously. I have seen miraculous results in old people by conium. Clinically proved. This is thuja. Everybody knows this plant. Maximum of you must be having in your house also. This is the thuja plant. And the great medicine for curing a case of is known as arbor vitae, also known as arbor vitae. And we always have these plants in this, you say, pots at home. So psychotic dyscrasia, I told you that this is one of the best antipsychotic medicines. And thuja, if really indicated, should be having some important mental symptoms of thuja. These mental symptoms are very prominent when you prescribe for a case of prostatic hyperplasia or in a case of thuja, and these are fixed ideas, as if a strange person is at his side, as if soul and body were separated, as if body is made up of glass. Inflammation of glands and purpures. Inflammation of glands and purpures is a symptom when there are tinge of gonorrhea. Normally, in case of prostatic hypertrophy, this symptom is not present. dwelling of urethra with split stream. This split stream is a very important symptom of thuja. There are 2 or 3 medicines which are having split stream. One of them is cannabis sativa. The urine is coming out in 2 streams. So that is very peculiar, very uncommon, and the best medicine in this case is thuja and cannabis sativa. All these are disease symptoms: sensation of tickling, desire sudden, urgent, cannot be controlled, frequent desire to urinate. But thuja should be given when there is psychotic dyscrasia and where there are some mental symptoms present to describe this. This is very important. Baraita car. This also is very good medicine for old patients. You see, there are 2 medicines which are specifically indicated for old persons, old patients, and Baraita car, conium maculate. These 2 are very good medicines, and the Baraita car patients are dull, very depressed, difficulty in initiating urine. Elderly who have difficulty passing urine and also suffer from dribbling or involuntary. So patient will be really harassed, really depressed due to his problem because he is old, he cannot pass urine frequently, you cannot go to the toilet very frequently, and he is having this constant urging to urinate, sometimes involuntary urination, very exhausted patient. So in these kind of cases, especially when the patient is very old, I am repeating, very old patient, conium maculatum, Baraita car. Remember BPH. BPH is benign prostatic hyperplasia. 3 very important medicines are: B is for Baraita car, P is for petroselinum, H is for hydrangea. Always remember these 3 medicines: Baraita car, petroselinum, and hydrangea. Next is this petroselinum. We use daily. We use this. This is what? Parsley, dhania. So we are daily using dhania patta. I always advise my patients who are having prostate problem to take dhania. They can have this parsley chutney daily. It helps. It helps. And there is one more thing which is supposed to be helpful, that is tomato. Ask your patient to take tomatoes. It is learned that tomatoes also help to prevent and to help in management of prostatic symptoms. Parsley, dhania, and tomato. So petroselinum, it has been cultivated for more than 2000 years. The ancient Greeks held parsley to be sacred and used to decorate the tombs of the deceased. The practice of using parsley as a garnish actually has a long history. We are using parsley as garnish. Which bhi hum banate, whatever we make, you put garnish. You garnish with parsley. There is burning, tingling in urethra, sudden urging to urinate, irresistible desire to urinate, biting, itching deep in urethra. If there is constant irritation, constant feeling to go for urination, all these symptoms belong to petroselinum. Very, very helpful. Try it in your practice, you will be benefited. Hydrangea. Hydrangea is one of the best medicines for a case of prostate gland. Hydrangea, it has been used for hundreds of years as a treatment for enlarged prostate and is often combined with equisetum for this purpose. In the ancient times, people were giving hydrangea juice and equisetum juice. These 2 medicines for relieving the case of prostate gland. Hydrangea is one of the best medicines. It is a stone-breaking medicine. It has a very specific action on the urinary tract. We know that. It is very high in silicon, needed to maintain flexible arteries, especially important for good blood circulation through the filtering tubules of each kidney. It contains cyanogenic glycoside, volatile oil, saponins, flavonoids, and other constituents which are helpful to regulate the urinary filtering system. And it is associated with renal stones, burning in urethra, urine flow to start, sharp pains to loin, enlarged prostate with great thirst. You see, there is a history with hydrangea. Hydrangea has been used since hundreds of years, and it has several colors. And each color, it is a story, history, that each color indicates a different emotion. So people were giving hydrangea flowers to people to emote, to express their emotions. You can see there are different colors: white, green. See, these are the different hydrangea plants. Yellowish and bluish. So all these things are indicating, you see, it was seen and used. This plant was known as change rose. Change in color of rose type of a flower, like pink was for love, green was for revenge, anger, white was for peace. So all these colors indicated different things in the history. And there was a king in Japan who was very busy in a fight with enemies for a very long time. And he used to send pink hydrangeas to his wife daily, expressing his love. So this plant is having a very important place in the history also, and in the place in homeopathic history, that it is one of the best medicines in prostatic hypertrophy, especially if it is related with urinary problems, sometimes also associated with urinary calculus. It is known as a stone breaker. Hydrangea is most famous as a stone breaker. When the renal stones are big in size, you give hydrangea mother tincture with a proper indicated medicine, you will be getting much help. Ferrum petritum. This ferrum petritum is very good medicine when there is a constant desire and retention of urine. Ferrum petritum, one of the best medicine for senile prostatic hypertrophy. In old people, when they are unable to pass urine, they are not able to strain a lot due to old age, due to weakness of the urinary bladder muscles, that is detrusor muscles, they become weak and the patient is not able to press. So that is why he is getting frequent micturition at night, because the urine is being accumulated, it is not being passed properly. So in old age, if there is frequent urination, involuntary urination, constant dribbling, there are 2 or 3 good medicines. One of them is Ferrum petritum. Don't forget Ferrum petritum, Petroselinum, and one is Chimaphila. Chimaphila is also very good medicine in these cases, and Chimaphila is especially indicated when due to constant retention of urine, there is urinary infection. Chimaphila. There is prostatic enlargement, urine with ropey, mucopurulent, that is urinary infection. Smarting in urethra from neck of the bladder to meatus. Forked stream is divided, unable to urinate. This is very important symptom in Chimaphila, that the patient is not able to urinate without standing with feet wide apart. He takes his feet apart, wide, and then constantly strains for passing urine. Then only he is able to pass urine. Otherwise, normally by sitting, he is not able to pass urine. Next is Staphysagrea, one of the best medicines for prostatic hypertrophy. There is straining and incomplete emptying, urinary urgent, frequent urge to urinate, but the specificity in Staphysagrea is that all these are disease symptoms you will see in almost every case. So how will you differentiate? The Staphysagrea is having a very peculiar symptom that the urine comes down, then it rolls back. This is not present in so many medicines. But in staphysagria, we will see patient will say the urine comes down, comes into urethra, comes to eyelid, but again it goes back. It takes the reverse direction. If this symptom is present, the staphysagria is the best medicine. And in some cases, you will see that after some surgical operation, sometimes if the patient had retention of urine and he was catheterized, normally we catheterize a patient if there is severe retention of urine so that the urine passes and the patient feels comfortable. But due to regular use of catheter, there are sometimes deposition of fibrous tissue and some stricture takes place. So if there is those kind of a symptom, especially after surgery, the staphysagria is one of the best medicine. Peculiarity, sensation as if a drop is always rolling in the urethra. Don't forget this symptom. You have to differentiate. Cantheris. Cantheris is, I will say, not 100% medicine for prostatic hypertrophy, but it is one of the best medicines for complications of prostatic hypertrophy, especially if there is infection. One of the best medicine for BPH, but why? With severe burning urination. Burning before, burning during, burning after urination. These are the three characteristics of cancerous patient: burning before, burning during, and burning after urination. And there is intense sexual desire. This intense sexual desire was present in conium mac also. The conium mac and cancerous. And the urge to urinate is intolerable. Severe burning pains, constant urge to urinate, like present in the cancerous patient. But it is useful to relieve these symptoms. It is not a very helpful medicine to reduce the swelling of the prostate, but very helpful in symptomatic relief. Urticariaceae. This is a new medicine being researched, and this is a medicine for BPH and renal impairment. And this also has been researched and confirmed by Boston University, USA. So this is a help in renal and cardiac impairment, has been approved by the German and American health officials, that is Boston University. And it decreases the residual volume and increases urinary flow and helps in the enlargement of the prostate gland. This is a new medicine, Urtica dioica. You can write the name also. Very soon it will be available as a homeopathic medicine. And the quality of this medicine is antimicrobial, antioxidant, hyperprotective, antiviral, anti-diabetic, and all that. So this will be the future medicines of next. Mark my words, please note this name. This will be ruling the prostatic treatment in future. The medicine is Croton membranaceus. This is the medicine plant. This is the Croton membranaceus. This is one of the best medicines for, supposed to be one of the best medicines for prostatic hypertrophy. This medicine has been taken since ages in Ghana. Ghana is an African country. Extract used as a medicine for BPH in Ghana since years. You see, for the treatment of prostate, we focus on 2-3 things. One, there is a inactive testosterone in our system. This inactive testosterone is converted into active DHT, dihydrotestosterone, by an enzyme that is known as 5-alpha reductase. 5-alpha reductase converts testosterone into very active DHT. And if DHT level is high, there will be prostatic hypertrophy. So it has been seen that it reduces the 5-alpha reductase. It is well proved So if it reduces the 5-alpha reductase, what will happen? The testosterone will not be converted into DHT, and if it not be converted into DHT, the prostate enlargement will be less. So there will be, it shrinks prostate. There is an international scoring policy that is known as IPSS. I have discussed this last class. International Prostatic Scoring Society. So it is having 7 points, and all points have been given 5 points. So if you are having 7 symptoms, all 7 symptoms, I have taught you last time that known as FUNWISE. FUNWISE. These 5 FUNWISE are the 7 symptoms. So it has been observed that if you are having all 7 symptoms or some of them, this medicine can reduce your problems by 15 points. So 3 or 4 symptoms can be helped by these medicines. And specification of this medicine is that it targets only prostatic cells. So it acts only on prostate cells. It reduces PSA remarkably. We know PSA is prostate-specific antigen, which increases in case of prostatic hyperplasia. If there is prostatic hyperplasia, you will see that these things are increased. And this is one medicine. It is not come in homeopathy, but it has been extensively used as medicine for BPH. So there are chances that within a short time, this medicine will be available as a homeopathic mother tincture, and I hope that this will help all the physicians. Remember the name Croton membranaceous. You see, we are discussing the DHT level, 5-alpha reductase level due to reduction of the testosterone level. And one very strange noting is there that if a person is castorized, if a person's testicles have been removed due to some problem or other by surgery, or eunuchs, eunuchs traditionally they cut the testes of the person. So if you are not having testes, if the person is not having testes, he is not getting prostatic hyperplasia. It is proved. There is evidence. It was researched that if you are not having testes, so you will not have a prostatic enlargement. Why? Because testis is producing testosterone. So if you are not having testosterone, it will not be converted into DHT, and it will not be converted into DHT. You will not have prostatic enlargement. So there is a condition that after castration, no person will get BPH. One medicine is Prunus spinosa. The Prunus spinosa is a very important medicine when there is severe irritation, problems, involuntary urination, frequent urging to urinate. All these complications are very well covered by Prunus spinosa. And Prunus spinosa is also having that symptom that urine comes down and then it goes back. Patient will always feel that some drop of urine is remaining in the urine. So that is very, very indicative of Prunus spinosa. I have been helped greatly in my prostate cases with this symptom by Prunus spinosa. There is one more medicine that will come, but this is very, very important. Mind it, remember it, Prunus spinosa. And the same kind of symptom is also present in cannabis sativa. When you will see cannabis sativa or you will study cannabis sativa, the same kind of symptoms are there, but cannabis sativa is associated with severe constipation, which is not the case in Prunus spinosa or Thuja or Conium. It is also having a split stream, dual stream of urine, hurriedly impelled to urinate, BPH with retention symptoms. And if there is BPH with retention of urine, then Prunus is one of the best medicine. Mind this. And the peculiar symptom is that urine comes down, then goes back. And patient is always feeling very restless, embarrassed in public places, that he is always having the urge to urinate. When he goes, urine doesn't come. Only drops come, but when he comes back, he again feels that some portion of the urine is remaining in the urinary tract. Solidago. This is our homeopathic catheter. One of the good medicines when there is retention of urine, when there is cystitis, kidney infections with BPH, reddish brown urine. This reddish brown urine may indicate some portion of the blood. And very helpful in case of retention. Makes the use of catheter unnecessary at times. This is written in Dr. Borik's Mathematica, in the chapter Solidago. You can see, you can observe that Dr. Borik has told that it sometimes it makes use of catheter unnecessary and helps in passing the urine properly. So remember, our homeopathic catheter is Solidago. Always remember this medicine. And when we go for this IPSS, we were discussing the IPSS scoring. This IPSS scoring is, if it is 0 to 7, I have told you there were 7 symptoms, fun-wise. Frequent urination, incomplete urination, like that, we have discussed in last class. So 0 to 7 will be known as mildly symptomatic. 8 to 19 will be more like moderately symptomatic, and 20 to 35 score is severely symptomatic. And the medicine which I told you, this medicine, always remember the name, Croton membranaceus. It reduces the IPSS level by 15 points. Always remember this medicine. This will come in homeopathy, I can tell you very strongly. Now, general medicines for prostatic enlargement are Thuja, Savalcerulata, Chimaphila, Staphylococcus, Hydrangea, Ferrum Pic, Solidago, and Conium. But as far as surgical treatment is concerned, we are not going to do surgery, but I will request you to have a look of the treatment nowadays, what is being followed in allopathic science. That is, one is catheterization, simple catheterization, if there is retention of urine. Surgical help, there are surgical processes. TURP, transurethral resection of prostate. That is a surgery. Prostatectomy, when the entire prostate is removed, but this is very less common. Prostatectomy is not common nowadays. TURP is the most common, and there are laser treatments. We'll try to learn something to see this TURP, transurethral resection of prostate. Please, but just see to know how they are doing it. We should know these things.
Your surgeon will begin by slipping a small lighted instrument called a cystoscope through the opening of your penis.
Cystoscope is
After
inserted.
instilling sterile solution through the cystoscope for better visibility, your surgeon will carefully examine the inside of your urethra, prostate, and bladder. He or she will then pass a resectoscope, which essentially consists of a small wire loop carrying an electric current through the cystoscope, and use it to shave off layers of prostate.
This is carrying an electrical current. Due to the electrical current, this enlarged prostate is being burnt off, cut off. So by this, the part of the prostate which was covering which are obstructing the urethral passage is removed. So this surgery is known as TURP.
These bits will be washed into the bladder and out through a special port in the cystoscope. When an optimal amount of prostate tissue has been excised, your surgeon will remove the cystoscope and place a catheter into your bladder to keep it draining for up to 2 days after the surgery.
So this was a very small introduction of TURP, transurethral resection of urethra.
Your surgeon will begin by
Natural energy stored in water vapor.
Now there is one more treatment that is known as water vapor therapy. Hot water is being inserted, and due to the heat, there is improvement in the prostatic enlargement. Just watch and see.
Or steam. It is a safe and effective treatment available to relieve symptoms associated with benign prostatic hyperplasia, or BPH. During each 9-second treatment, sterile water vapor is released throughout the targeted prostate tissue. When the steam turns back into
This water vapor is released into the prostatic tissue, and then when it cools down,
water, all the stored energy is released, causing the cells to die. Over time,
so the enlarged cells die due to the heat.
natural energy relieves symptoms associated with benign prostatic hyperplasia, or BPH. During each 9-second treatment, sterile water vapor is released throughout the targeted prostate tissue. When the steam turns back into water, all the stored energy is released, causing the cells to die. Over time, your body's natural healing response removes the dead cells, shrinking the prostate. With the extra tissue removed, the urethra opens, reducing BPH symptoms. Most patients begin to experience symptom relief in as soon as 2 weeks, and maximum benefit will occur within 3 months. Natural energies.
This is a green laser treatment, very successful nowadays. Just watch. The stethoscope is inserted into the bladder. This is the laser which is burning the extra growth tissue. Now this is cured. And the last treatment is very popular nowadays, that is prostatic urethral repair. They repair the prostatic part of the urethra, and it is very successful. Just see the surgery.
Secondary symptoms and improved quality of life with minimal side effects for men with an enlarged prostate caused by benign prostatic hyperplasia, or BPH. The UroLift system procedure begins by inserting an implant delivery device into the urethra. An attached endoscope provides visibility to the obstructed prostate. On reaching the area blocked by the enlarged prostate, the obstructive prostate tissue is moved aside. Following a trigger press, the device inserts a fine 19-gauge hollow needle across the prostate and deploys the implant through the needle. The implant is a nylon suture fixed in place with a thin metal tab at each end. Depending on the prostate size and blockage severity, the doctor inserts several more implants the same way. Typically, 4 to 6 implants are placed into the prostate. The outer capsule of the prostate is firm and provides a solid anchor, which allows the implants to lift and hold the enlarged prostate tissue out of the way so it no longer blocks the urethra. As the sutures are shorter than the prostate depth, the prostate laterally compresses. This reduces pressure on the urethra and provides immediate visible results so urine can flow freely.
This passage
It's a
is clear
mechanical
now.
solution to a mechanical problem. The minimally invasive procedure requires no cutting, heating, or tissue removal.
It was first
This
this, now it is like this.
Secondary symptom.
So we had discussed some parts of the medicines, only therapeutic part, which are the medicines. Some guidance for the symptomatic therapeutics, like we have been known there is FUNWISE, FUNWISE. These are the 7 most important symptoms of prostate. So F is for frequency. And for frequency, the best medicines are Sabal, Chimafila, and some other medicines are also there. That is Epis, Cantheris, and Sarsaparilla. So these are the some medicines which are very helpful, especially in case of frequency of urination. If the frequency is more, Sabal Cerbulata, Chimafila, Thuja, Conium, Epis, Cantheris, and Sarsaparilla. Next is U, urgency. In case of urgency, epismel, that is stinging, burning urgency, mercor, burning urethra. Though mercor is not a very specific medicine to help in benign prostatic hyperplasia, but it will help you if there is severe urgency symptomatically for some time as a temporary measure. As a palliative measure, mercor will help you, but the curative medicines are, if urgency is there, Sabal Cerbulata, Chimafila, and Ferrum picnica. N, FUN is N, nocturnal. Nocturnal urination. Patient is harassed, patient embarrassed. He has to go several times at night. And medicines are Sabal Cerbulata, Chimafila, Staphysagrina, and very important and most commonly used medicine for nocturia is causticum. So causticum doesn't help much on a prostatic enlargement, but it helps you for controlling the bladder muscles, detrusor muscles. That muscle is very nicely controlled by causticum, sepia, and staphysagrina. Staphysagrina is especially after surgical procedure. W is weak stream. W is weak stream. That is Sabal, Chimafila, Thuja, and Conium. And some other medicines I described: cannabis sativa, equisetum. I have already told that hydrangea and equisetum are very good medicines. And copaiba. Copaiba is not very regularly used, but it is good medicine if there is cystitis. If there is inflammation of the urinary bladder, if there is infection in the urinary bladder, offensive urine, sometimes retention of urine, in that case, a very good medicine is copaiba when there is weak stream. Intermittent urine, I. FUNWISE, WI, I is intermittent urine. That intermittent urine is Sabal Cerbulata, Chimafila, Thuja, and Staphysagrina. But these 3 are more medicines. Paraira brava. Paraira brava, always remember, this is one of the best medicines for any urinary difficulties if there is renal calculus. Very good medicines when you have a renal calculus with prostatic enlargement and patient has to strain a lot. He has to bend a lot to pass the urine. That is Paraira brava, which was the case in Chimafila also. Clematis also is a symptomatic treatment for frequency and urgency of the urination. S is for straining, severe straining. We have already discussed this, that Chimafila is there. He can't sit and pass urine, has to stand, has to bend his knees, has to wide apart his legs, and then the urine can be passed. One helpful medicine can be belladonna, Cantheris if there is severe burning, and Sarsaparilla if it is related with urinary calculus and severe burning at the end of urination. There is a medicine, Cantheris, which is having burning before, during, and after urination. Sarsaparilla is very good medicine when there is severe burning pain at the termination of urination. And last but not the least is emptying not satisfactory, emptying not complete. Chimafila, Thuja, Staphy. This was on the basis pulse is one of the medicines, Nux vomica and Lycopodium, but the best medicines are above. So on the basis of symptoms also, we have discussed some medications. Due to lack of time, I'm not giving complete details in these medicines, but let us finish my part here. I hope you will have liked it. Thank you so much. If you have any questions, you are most welcome.
Yes, really a wonderful session, sir, once again. you covered all the part of this prostatic hypertrophy and prostatic cancer, and what are the things to be done, what are the things not to be done, how to trace the case, and what are the remedies coming in front of you, and how one need to differentiate the one remedy from the other, and how one can use all these things and everything. Even at the end, you have shown what kind of surgeries are doing by the so-called surgeons for the same conditions. So we really have a wonderful session from. We are very thankful for you.
Thank you so much.
We are very thankful, sir. Now let us have a discussion, and those who want to have a chat with sir can come out, and those who want to discuss any doubt, you can also ask the questions, as well as you can say your additional knowledge to this session also. Yes, it is up to Dr. Hariharan, sir. Yes, sir. Please unmute.
Okay, sir.
So, sir, good evening, Dr. Hariharan.
Good evening, sir. Good evening,
Nice.
good evening. Very glad to meet you, sir. Very
Nice.
glad to meet you. It is a very wonderful class, sir. Very informative, very informative. Sir, I have a patient. That
Yes.
patient is having this prostatic enlargement along with one nodule at his urethra. I mean, not urethra, urinary bladder. Along with these BPS and nodules. I mean, in the lower part of urinary bladder, there is a nodule. Which medicine it will come, sir? It may be I gave Tuja along with the BPF hypertrophy medicine and constitutional medicine, lycopodium I gave. I don't know how it cover it. Sir, what your opinion? Any medicine in your mind? At your mind, sir?
I would suggest to go for a proper investigation that what kind of growth is there in the urinary bladder. Sometimes what happens, a part of prostate gland gives pressure into the urinary bladder, and it looks like a swelling in the urinary bladder. So that is one condition. There is a separate extra growth in the urinary bladder. So we have to find out that what the exact cause is. Can
Okay,
I
sir.
share my screen?
Okay, I have. Okay, sir. The PSA is very high, and after administering this medicine, the PSA will PSA came to normal. That is the positive
That is
reaction.
very good that you are giving relief to prostatic symptoms. But what happens is, I will try to show you. Can you see this slide?
Yes, sir. Yes, we can.
You can see this is an ultrasound report. This is the prostate gland.
Okay.
And here you can see this part of the prostate gland is entering into the urinary bladder, encroaching into the urinary bladder, and this is looks like an extra growth in the urinary bladder. This is the urinary bladder, and
Okay.
this is a part of the prostate gland
Okay.
which has entered. So we will have to be very sure that what if this is the case, we will give medicine to reduce the prostate gland, and this may come down. But if it is an extra growth in the bladder, then we will have to consider differently.
Okay, sir. Thank you. Thank you.
And in that case, and Thuja is a very good selection.
Okay.
But I would suggest if it is related with conium, this part of prostate entering or pushing into the bladder, then one of the best medicine will be conium.
Okay, sir. Okay.
Conium maculatum, third potency.
Okay, sir.
I am specifying the potency also, because conium 3 is very remarkably functioning in these kind of growth. I have several cases in which the enlargement of prostate has come down drastically after the use of conium in old patients.
Thank you, sir. Thank you, sir. Okay, thank you, sir. Thank you, sir.
Welcome.
Okay.
Excellent question and beautiful answering. Now, Let us go to Dr. Narayan. Yes, Dr. Narayana, you can speak.
Good evening, sir.
Good evening.
Sir, excellent session.
Thank you so much, sir.
Previously missed the session. Latest techniques in the surgery. Because I know and I attended with
knowledge
the
of
urinary urology.
Yeah.
TERP I have seen. I attended the surgery also during my PGs. Post-graduation in Patna, sir.
Okay.
And latest surgeries, what you have revealed is latest, we don't know as homeopaths, but latest techniques are going on. As a teacher, as a student, as a evergreen student of homeopathy, you are better than the surgical surgeons in allopathy, sir. The teaching methodology, and I heard you.
What
Yes,
I believe
here,
is that we must be aware of the latest advancement. We are not going to perform surgery.
yes, sir.
But
because we are not
you will say the patients, they are coming from big hospitals and all these terms are being used.
Yes.
So in these cases,
and
if you are not
concerning
aware, yes,
yes,
please.
sir. Concerning that medicines you have explained, rare drugs, Pereira breva is the drug where the patient kneels on the 4 limbs, just like dog. While passing urine, he has to take the position just like dog and strains.
Yes.
That is indication for Pereira breva, sir. In
Pereira brava,
especially
the Pereira brava already have this symptom, but the Pereira brava is mostly indicated when there are stricture of urethra, when there are problem of urination. But Pereira brava is not the choice of drug for prostatic enlargement.
Yes.
Not prostatic, sir. This is it is concerned with gonorrheal complications.
Yes, that is
mainly.
But you see, to be very frank, nowadays you will not get cases of gonorrhea.
No, sir. Next, petroselinum and tulja, and these two are similar symptoms, as if the urine comes to the glans penis, fossa navicularis, and again the patient will have the sensation as if it returns back, and some kind of gurgling is there.
Yeah, that is
Gurgling sound. Gurgling sound.
Yes.
Just like this.
Yes, Dr. Narayana, our time has come already over. So as 2 more persons raising hands, so we can have a discussion in the coming edition of this. And now,
Dr.
Deepanjali, you can unmute.
Good evening, sir. I want to discuss about one case of mine. He is a 70 years male with the prostatic enlargement, and his constitutional medicine is causticum. So, in which potency I should give him that he also he has also undergone bypass surgery?
See, there is a very simple theory given by Dr. Nash. Most similar the medicine, higher the potency. So if you are very sure that he really belongs to a causticum patient, so you should start with a mildly higher potency and then see the results. And intercurrently, Thuja is a must.
Okay, thank you. And the thing is that where I got the hint that the causticum would be the right medicine. And 2 medicines I selected. One is lycopodium and other was causticum. But I came to know that, hello?
Yeah.
Am I audible?
Yes.
I came to know that he has strong interest in politics.
I see.
And he was a student leader.
You see, there is one more theory that during proving
Ji.
a medicine is able to produce some symptoms, okay, some changes in the system. If
Hanji.
the medicine producing such changes in the drug proving, then that will be the best choice. You go through the physiopathological action of causticum, and if causticum has a capability to produce prostatic enlargement, then causticum will be the one of best medicine.
Okay. And what about lico? It also usually indicated for
Liposuction
the...
in general is not the choice of drug for enlargement of the prostate.
Okay, sir. Okay, okay. Thank you so much. So
Right.
you mean to say that the potency to start with is 200, is it so?
It is a reasonable potency to start.
Or what do you suggest about LM potency?
LM potency are very safe, so you can go for that also, but see the result. Give any medicine in any potency, but observe the result. You
Okay.
should be very well prepared for the second prescription.
Tomorrow we will have a
Okay,
session.
thank you so much.
Okay, tomorrow we will have a session from Dr. Deeksha Garg. Where she will be presenting a role of homeopathy in renal stone. So the continuation of the same system is going on tomorrow also. So all of you are requested to be requested to join the session. And now I invite Dr. Ramparesa to say a vote of thanks to this session.
Thank you, sir. Very
Thank
nice
you.
presentation. Excellent session.
Thank you, sir.
Excellent session. Enlargement of prostate gland. Very, very thanks. And according to mathematics, food is the best remedy. So very, very thanks, sir. We are IFPH, sir. Thank you. Very
Thank you.
nice. Thank you, sir. Thank you.
It is time for the next section.
Okay, sir. With that, we
Okay,
come.
sir.
Thank you, Dr. Ganesh. Thank you very much.
Yes, sir. With that, we are very thankful to Dr. KULWANT SINGH. Sir has produced so many presentations in this forum, so we can have some more presentation in the coming days from Sir. Hope
Sure.
Sir will be doing. So those who want to communicate with Sir, we will share the number also in the next write-up of the poster, that poster itself, so that you can communicate with the KULWANT Sir. At any time, sir will be at your service at any time. That kind of personality, sir.
Sure.
So with that we come. With that we come. With that we come to the end of the day 1247. Thank you all for this wonderful session.